Russ, I've heard you use a term before that's perplexed me, and I want to ask you about it now. Creative hopelessness. What is that all about?
Okay, so creative hopelessness is not a term that we would use with clients, but it's a term found in our textbooks. And it really refers to creating a sense of hopelessness in the agenda of control. So the control agenda is basically, I want to get control of my feelings. I want to get rid of the unpleasant ones. I want to have lots of the feel-good ones. And we've all got that agenda to some degree, but the more extremely you cling to that agenda, the more you go through life, I've got to control how I feel, the more problems it creates. So creative hopelessness, we're trying to create a sense of hopelessness in that agenda so that we can introduce an alternative agenda, which is the mindfulness agenda. And so this little exercise is really, it's just a chunk of the act in a nutshell metaphor, but we are going to use it to demonstrate how you can use it with creative hopelessness in a session. Now, are you happy to role play someone who's a bit depressed?
Sure.
Okay, so because in this role play I'm going to ask you to give me some of the things you've done to push away your difficult thoughts or feelings, and also some of the things that have happened when you've gotten overwhelmed by them. You can do that?
Sure, I have a lot of experience.
Okay, so what am I going to call you for this?
Let's call me Shannon.
Shannon. Okay, Shannon. Okay, Shannon. So you've been depressed for quite a while, and obviously you want to stop feeling depressed. You want to get rid of all those really unpleasant thoughts, feelings, emotions, memories we talked about, right? Can I ask you, first of all, what are some of the things you've done to try to get rid of those really unpleasant thoughts and feelings?
I drank a lot. I ate a lot. I cried a lot. I did a bit of yoga. I tried to exercise. I did affirmations morning and night. I wrote out my feelings. I beat my pillow with a cricket bat. Is that enough?
That's a lot. That's a lot of things. And obviously in a real session, you know, that would probably take 10 minutes or even 15 minutes to get all of that information, you know. Okay, so you've tried very hard. You've tried a lot of different things to make these difficult thoughts and feelings go away. And it's not really worked that well. Some of those things have given you some relief, but you're still sitting here in my room complaining of depression and all these painful thoughts and feelings.
Yeah, it's a short-term fix, and I seem to come right back to the same point of helplessness again.
Yeah. So that's kind of one way of responding to difficult thoughts and feelings. We desperately try to make them go away. There's another way of responding to them, which is we kind of get bogged down in them, caught up in them, overwhelmed in them. We get all entangled in them. Can you tell me some of the things, what happens when you get overwhelmed or bogged down or entangled in those painful thoughts and feelings and emotions?
I just don't know which way to turn. I get confused. I don't know which way to turn. Sometimes I get angry with myself for not knowing better.
So if I was watching on a video, what kind of things would I see and hear on that video? If I was watching Shannon at home, that I'd be able to go, wow, Shannon's really caught up, entangled, overwhelmed by those difficult thoughts and feelings. What would I see and hear?
You'd probably see a lot more isolation, because I would cut myself off from my friends and family because I didn't want to see them necessarily. I'd probably start a whole bunch of different projects and get nowhere because I was unfocused and not trusting myself. I wouldn't take as much positive action in my life. I wouldn't pick up the phone and try and get new work or experience new things. So I would kind of just give up.
Okay, so I'd see a lot of giving up, quitting, socially isolating yourself and so forth. Yep. So again, in a real session, we'd take 10, 15 minutes over that, you know, depending, but we'd go through all the things that happen. So then, if I want you to kind of imagine that this is all the difficult thoughts, feelings, emotions, memories linked to your depression. And it seems like we grow up in society and we get to learn only two ways of responding to these difficult thoughts, feelings, emotions. The first way is we get all overwhelmed by them, caught up in them. Can you, yeah, that's it. Kind of just hold it up in front of your face. This is what, get it a little bit close so it's touching us. This is what it's like to be totally overwhelmed, caught up, you know, entangled in these painful thoughts and feelings. What's that like for you?
My world is small and I can't see anything other than my pain.
Yeah, so you're kind of cut off, you're disconnected, you're missing out. You wouldn't be very happy going through life like this, would you, if this was your only way? The second way we learn is to try to make these things go away, fight them, try and make them go away. So push it away from you as far away as possible. Okay, so this is hitting your pillow with a keep it out, push it far away. This is hitting your pillow with a cricket bat. This is the drugs, the alcohol. I can't remember what the other things were you said now, but drugs and alcohol and positive affirmations and avoiding difficult situations and, you know, beating yourself up as well as beating your pillow up. You've tried a lot of different things to make this go away. Push it further away from you. A lot of effort, a lot of time, and it's not really going anywhere, is it? You know, it kind of, you know, goes away for a few minutes or sometimes a few hours, but it comes back and you're doing this. And imagine trying to go through your day like this. Imagine trying to do the things that make your life work. Be very difficult, right? You kind of, it's taking a lot of effort, a lot of energy. It's distracting, and it's not working very well. So would you be happy if these were the only two ways that you had of responding to difficult thoughts and feelings?
No.
Are you interested in learning something radically different, a totally new way?
Bring it, Russ.
Well, just try placing it on your lap there, and just let it sit there. Just let it sit there. Now, what's that like?
Well, my shoulders are more relaxed. I can see more of the world around me. I can see you.
Move your arms around, kind of, you know, you're free now to take action too. You can do the things that make life meaningful. You can type on a computer, drive a car, ride a bike, juggle balls.
Sure. Yeah. And yet my pain is still in my peripheral. It's not gone completely. I'm aware that it's still with me. It's just not everything that I'm focused on.
Well, that's right. Let it just sit on your lap there. And I want you to notice, so these are all the difficult thoughts and feelings. Now, you've got a choice. Right now, there's you and me doing something important, meaningful, kind of engaging in something. And you can give me your full attention now, even while this stuff is with you. Or you can get all absorbed in it. Just tilt your head down, get all absorbed in your difficult thoughts and feelings. You feel the life being sucked out of you. And now just come back, give me your attention again. Come back to the hair. The hair will always be here for you when you need it. Okay, you and me, do you notice the difference?
Is it bad that I'm a bit turned on right now?
So obviously we don't expect this in sessions. But you kind of, would you be interested in learning how to do this? Yeah. Because you've got, just kind of push it away again. You've already got a zillion and one different techniques that you've tried to do that. There's no point doing more of what's clearly not working. How about we learn to do this?
I'm very interested in doing that. Let's go.
Okay, so kind of a creative hopelessness intervention, would just tease all that out. But you could do that. I mean, you could stretch that out over 20, 30 minutes, or you could do it in a sort of 5-minute block. Depends on who the client is.
Why do you call it creative hopelessness?
Because what we're trying to do is create a sense of hopelessness in the agenda of controlling my feelings. And if I let go of that agenda, I've got to get control, then I may be open to the alternative agenda, which is mindfulness.
And I also get the experience in my body of being able to look away from my issues and see the world around me too.
Yeah, and it was nice the way you acknowledged that they were still there, but it doesn't have to pull you out of living your life.